your microbiome goes down, the beneficial goes down. We can still climatize with these little clever buggers because they can have biofilm. It's like bubble wrap, but, over Aunt Ida's like heirloom lamp, and you're going to travel somewhere, that bubble wrap to keep things really nice. That's a biofilm. And what happens is they become really resilient. When you change, they want to live. So if we keep doing this, we have no idea. And then the microorganisms, they're going to spread quickly. And then we get a little sniffle, boom. And then that can do premature death, right? So that's why I say it's kind of decrepit, and it's not to scare anybody. It was just to kind of say, this is like a big deal. 131 out of 100,000 people, blow my mind.
Welcome to the Clear Skin Chronicles, the podcast that takes you on a journey to uncover the secrets of achieving glowing, acne-free skin. We believe that knowledge is power, and by understanding the root causes of your acne, we can create a solid foundation for long-lasting clear skin. I'm Katie Stewart, registered holistic nutritionist and founder of the Clear Skin Solution, where we help women just like you get to the root cause of their acne.
And I'm Chris Brown, registered holistic nutritionist and program director in the Clear Skin Solution. Through functional testing, we pinpoint where the body system imbalances lie so we can dive deep into your acne clearing journey.
We work virtually with clients to clear up their skin from the inside out and have helped thousands of women worldwide regain their confidence.
So I think I should let you start this one. I'm not even gonna try.
Yeah, I like this one.
I'll let you go.
When it comes to antibiotics, and I can't even ever say that without almost that exhale. I should preface that when we start with antibiotics, there's a time and place. So it's never about that, ever. And even all our podcasts, everything's not treating clinically, assessing people, these types. We don't do that. But when it comes to antibiotics, I do get my knickers in a knot.
And yeah, like we said, let's put that preface out there that of course I can speak for both of us and say we are so grateful for the invention of antibiotics because they are truly a life-saving medication. They can save lives when it comes to those infections. And I'm so grateful that we have that access to antibiotics. And I'll let you continue.
And thank you, Alexander Fleming. I can't even say that.
It's okay.
See?
It's Friday. When we record, it's Friday. Don't worry. It's Wednesday when you guys are listening. It's Friday when we're recording.
So long story short, here's kind of the schematic of it. 1929, antibiotics, bam, came in like a force, right? Absolutely. It was to help against infections, right? This is a powerful weapon because look at our population. We always talk about toxins, right? Those are going to perpetuate into a stress-like response. The body's not going to be able to respond well. Boom, disease, all of these other things. It was really great. Increased mortality, allowed surgeries to happen, these types of things in order for the body to repair itself, to have like a fighting chance. Makes sense?
Absolutely.
However, here is where the knickers get into the knot. It is the over-prescribing.
And this is a known thing in the medical community. Like it's not a shock to our society that antibiotics are so heavily overprescribed. Like Chris, how many times do you think you had antibiotics growing up?
Like candy.
Like candy, actually like candy.
Like
every
candy.
Sniffle.
Like candy.
Yep.
Every sinus infection, acne, minocycline, tetracycline, erythromycin until I started actually vomiting blood. But whatever, that's all. It's okay.
Yeah, I think anyone that grew up in like the 80s, the 90s era, like the antibiotics were prescribed for literally every sniffle. Like when I think back, I think I've taken antibiotics like well over 50 times in my life because I was constantly sick with colds and flus and sinus infections, strep throat like every other month from as long as I can remember up until about my university days. So I think back and like, man, like I wish we knew better as a society that we didn't need to be like antibiotics aren't going to work when you have a viral issue going on.
Yeah, essentially that's what it is. So there is a time and place for antibiotics. My concern And we have live case studies. We have clients. Those are case studies, right? We get to start tabulating what's going on. We get to start seeing how many people come into the Clear Skin Solution and had antibiotics. I would say 99% of them.
At some time in their life. And are you saying for their skin or for either or? Just in general?
To me, it doesn't matter, because when I'm looking at a case file, I want every time you have a touch point, every time. We have a client inside the Clear Skin Solution right now, 7-year consecutive on an antibiotic prescribed by the leading dermatologist in her state. I want to give her a hug. I don't even like to touch people. I want to give her a hug, right? Because what do you think that's going to do? The impacts, right? She doesn't know any better. Anyways, I went, and of course I dug in, because I want to say, I'm like, let's see. I just finished teaching fundamentals of nutrition, and we talk about antibiotics, and we talk about supplements, and we talk about all these fantastic things.
And can I just say that when I sat down, Chris and I sat down in the podcast studio, usually, we spend like 30 minutes before our podcast kind of talking through what we want to talk about. We put some points, bullet points down together, keyword together. I sit down and Chris had already written 2 full pages of what she wanted to talk about. I was like, oh, I guess I'm not needed today.
And summary.
and summary. I was like, looks like I'm not needed here at all in the slightest.
In preface, Katie, it's because I wanted some actual tangible stats. Right?
Yeah, it's important to have those.
Like me just rambling. It's and I mean, of course I don't ramble. I shouldn't say that. Like, I'm discrediting myself in a sense. But I say rambling where I'm... Is there something you'd like to share with the class, Katie? Is there? I have a sore finger, I'm a little bit testy today.
Oh, Lord. If I hear about this finger one more time this week, I'm going to lose it.
Katie wouldn't even allow me to put in a workplace incident accident.
First of all,
it was a workplace incident accident.
It was not a workplace incident accident. It was self-inflicted finger prick for a functional lab.
Of a course I have to take so that I can be smarter.
Oh, have to take, you see. Do you see the word she said? Have to take. This is a course she insisted that the 2 of us take together. Insisted. And a part of it is doing functional labs on yourself. And you had to do a finger prick. I did this myself. Yeah, it hurt like a mother when I did it. Went away within a couple days. But I have been hearing about this ridiculous finger prick from Chris pretty much every day this week. My text messages, my Slack. I'm surprised she's not calling me at 3 a.m.
By the way, I'd just like to say both Paige and Katie have given me zero empathy here. My finger is purple. I can't even touch things. It's black in some areas.
You didn't follow the instructions. You were supposed to do the side of the finger, not the top of the finger.
I want to stop talking about my finger.
So do I. I want to stop talking about your finger.
Fine. I'm going to talk about antibiotics.
Back to antibiotics, everybody.
When you look at it, okay, let's put it in preface. When you look at antibiotics, this is how it's told to the world. It's like a magical quality of killing disease-causing bacteria without killing its own cells or the cells of plants and animals. Who is not lining up for this? It's magical. You know how like people want the magic wand? They want their disease to be gone, and like this is the magic wand. This is why we line up for this, right? But we have to really watch because it's being overprescribed, and that's going to cause a thing, and I'll talk about it later, antibiotic resistance. That means ineffective. So what do you think a 7-year compound, what do you think consistent, even 6 months of taking it does, right? I mean, it kills the good and the bad. It's very naive to think it's, where it says it's not going to go kill your own cells. Yeah, it's not going to kill your own cells, but it's going to kill all the bacteria. And if we're more bacteria than we are cells, problem. So in my little bit of a tangent today, as you would probably like to call it.
A very 1 hour tangent, everybody.
So which I would like to say, yes, I very much planned for today. And I also typed with a very sore finger. Okay, so back to antibiotics here. Everybody, she gave me an eye roll. All right. So when we look at it,
if they're watching on YouTube, right now, because our podcast is on YouTube, they would have seen the said eye roll.
Go back and look at the eye roll. I'm just letting everybody know.
Right.
So according to the Canadian Government of Public Health, so in 2017, so remember, I can't always get like current. We had a 2.5 year hiatus of something just recently that probably skews some information. So 2017, pretty solid information. So this just alone, Canadians filled over 24 million antibiotic prescriptions, primarily in what they call community pharmacies, right? So in this same document, the publication goes on to say, we don't know how many of these prescriptions in Canada were provided unnecessarily for illnesses such as common cold, flu, or viral sore throats. Why do we go to the doctor most often? Because we don't feel good. Because it didn't resolve quickly. These types of things. It is really, that's how it looks. So if we're going to look at our southern counterpart, the United States, the national data suggests 30% of oral antibiotics are unnecessary.
That's a big number. That's not a small, like 30% is a lot. Like that's millions and millions and millions of people.
I also have to say, this research is calculated, one, from pharmacies, but two, doctors only if they reveal their data and only if it's electronic. So doctors that are still handwriting, they have to submit. If they don't submit, sorry, I shouldn't say they have to, because that indicates that it's part of their protocol. They don't have to, but if they don't submit, we don't have the actual facts. So here's the breakdown. 65% of antibiotics are from general practitioners and doctors, 22% from dentists, nurse, and pharmacists. Don't even get me started how pharmacists now can prescribe, because Spironolactone and Accutane and acne are on there. And then 13% from, wait for it, dermatologists and pediatricians. That 13% sounds like nothing in the grand scheme of it, but it makes me nauseous. That's a specialist. So you've already been in that 65 percentile. Then you're so lucky. A specialist will see you. You have a bad enough case. Go for it. And now you're put into 13% where you're going to get more antibiotics, right? So what do you want to add to that, Katie? Because
I'm just nodding along because I'm getting a little like fearful of my safety today. Everybody, I'm a little concerned.
I'm not myself. I do have a sore finger.
Okay, so I'm going to include something. I'll include one little thing. So what's really interesting, right, is we're like, oh, antibiotics, they're not that bad. They're not so harmful. Well, there's a number of studies, including one that was done in the Lancet, I believe that was back in 2022-ish. Mm-hmm. And all of these studies are finding that a single short course, remember, a short course is anywhere from 7 to 14 days or maybe even up to 21. But that general short course, which is most often much, much shorter than what acne sufferers are on, which are months and, as we've said, years at a time. So these studies are finding that a single course of short-term antibiotics alters the gut's microbiome, and it can take not only months, but even years to recover the original species of the composition of bacteria found in your gut. Years to recover. Yeah. So if we are taking antibiotics like candy every other month for this, for that, we're taking long-term antibiotics for acne. We can just imagine what this is doing to our gut. And there's a growing number of studies that are finding that these short courses antibiotics, they're altering that bacterial species makeup in the gut. And what I found really interesting in this study, I want to make sure I read it correctly, is that with some people's microbiomes, they started to resemble those of critically ill ICU patients after taking antibiotics.
Yes. This is where I'm going with this right now. You know why I get excited?
Well, Chris, I equally get excited about antibiotics, but I just thought I would let you have this one because I usually, go a little hard on the whole like birth control, women getting dismissed in healthcare, that kind of stuff.
This is, I just don't love antibiotics as a whole, right?
Unless absolutely required.
Outside of 100% needed, right? And I'm not the judge of that. Like, let's be clear. Like, Katie and I, like, please don't come to us and say, oh my gosh, should I be taking this antibiotic? I don't know because I'm not your doctor. I'm gonna, two people this week alone. Okay, I'm being put on this script, this antibiotic. Why? Because the doctor thinks that my infection still is lingering.
Thinks.
Right? Thinks.
Lingering.
That's the word. And sometimes I go after the word. Sometimes I'm a little bit, okay, But okay, this is what I'm saying. It begs the question. Why are we taking it and why are they being prescribed? If we know the information.
We have to ask those questions. We have to ask those questions.
Yeah. So I looked this up again and another government site. I'm so surprised that the government site even put this on here, right?
I'm surprised they haven't banned your IP address.
Yeah, they should.
They should. They need to ban your IP, to be honest. I'm sure you're on a list somewhere along with me. You and I are both on a list somewhere.
Yeah, for sure. Like the supplement most wanted list.
Oh yeah, we're on a list. We're on a list.
So this is why. And again, and I like to use the word government because remember, like in Canada, we are like a pay for service. Essentially, we go to the doctor, the doctor charges the government for that service because we pay through taxes and more taxes and then death taxes and then food taxes
and more taxes and more taxes.
Yeah,
and taxes.
So if you are from the government in Canada, please reduce our taxes, right?
Chris, come on now. We'll see pigs fly before the Canadian government reduces taxes. Let's not get us started on the tax situation here in Canada. Let's not.
Oh my gosh, right?
That's a whole nother can of worms.
So this is what it divulged, is the reason why we have antibiotics overprescribed is it depends on how busy the clinic is. What does a doctor need to do to get you in and out so that they can continue down the list with their sick patients? So by concept, it sounds nice, right? Like essentially think about this, like, okay, like, I want to absolutely help everybody if I want to look at it that concept, but I really never look at it that concept. So we'll just digress. So the ability of the medical guidelines and the tools, what the heck? If their ability to use the guidelines, their availability to have the tools. So many doctors feel pressured. That was the information they retained from doctors. We feel pressured to give our patients result. So they say it's their expectation that they need to stop it for that patient. And I would say, is this true? Not according to the Canadian government's own descriptions, because that means that doctor is going, I have to find them resolution. I have to fix this. Is it okay to say, I'm not quite sure? Let's do more testing? But more testing is going to push those timelines. You get about 5 minutes. 5 minutes with a doctor in a Canadian setting. Used to be 15, went down to 7, now it's about 5. How many people can we put in 5 minutes? Is that effective treatment? You be the judge. Most patients, they want advice and reassurance. How do we know that? Because our clients are those patients to those doctors. And when we hang with them inside the Clear Skin Solution and we sit with them for at least 45 minutes just on an intake to understand what they've been through, what they've taken, how they feel, all of the schematics while we're waiting for other results of different things as well. Wow. Do they ever feel heard? So this is why I love that holistic, or, you and I often call it like functional nutrition, because we're functionally working through it, right? Mm-hmm. The body has to reclimatize. So what about how we view antibiotics as a society? Not how Katie and Chris view it, emergency medicine only, but how does society? We drive up the expectation to feel better. And now we're back to that. We always talk about that Prime membership.
Amazon Prime.
We want it here in 10 minutes. We want to feel better. Remember a long time ago, there was a baseball player, Katie, that we were helping with acne.
Oh, yeah. An MLB player.
Strep throat, right?
Mm-hmm.
Most often your body can take care of strep throat, but it hurts like hang. It's not comfortable, right? It kind of feels like death. Now for everybody else, I'm not saying wait it out, please. Like do your due diligence. But he elected pharmaceuticals and antibiotics which elected another round of that because it didn't catch the strains, all the strains. So it had to go higher and more aggressive, right? So think about that, all the way from Major League Baseball players to professional Olympians to, so it's not just you and I. Like, we call ourselves more like the common people, the people just hanging out, like running the ground.
It's also seen it everything.
Big people.
Yeah,
right?
we've worked with, like you said, Olympians, MLB players, Hollywood actresses. Like, we've worked with everybody from celebrities to, you know, the common folk like you and I. And it's rampant. Like, it doesn't matter who you are, what you do for a living. We see this consistently.
And what my whole thing is some people have more money to put towards their health care.
Absolutely.
And still use Western intervention because it's easy. But the whole concept of that was, we were told it hurts and I just don't want to deal with the pain, so I'm going to take it. That's okay if that's the way you want to go. Of course, it does hurt. But here's the big factor is we trust our 7, in fact, it's actually a 10 because they have to do 4 years of, you know, an undergrad medical student, now doctors, those professional opinions. We never ask why. We assume they know.
Well, it's because we have white. Yeah, I was going to say we have white coat syndrome.
You better believe it.
It's almost like our society is fearful of asking questions of their doctor, when in fact they should be asking questions of their doctor. You know, they don't work for their doctor works for them. And they should be, you know, feel comfortable and be allowed to ask questions when it comes to something with their own body and their own health. And to be honest, like, they're, you know, it's few and far between, but there are some really wonderful doctors out there that, you know, sit with their patients and answer their questions. Like, we had Dr. Aaron Gilson on the podcast, and he is such a wonderful doctor. And he was saying how he sits with his patients for a while and answers every question they have, does follow-ups. So there are some really wonderful doctors out there, but unfortunately that is the few and far between.
Yeah. And post-surgery, right? Okay. Like, there's going to be time and need. That's what I'm saying. Here is what I offer everybody listening today. Please be an advocate for yourself. I want you to ask, what's the antibiotic targeting? What species are seen? How is this antibiotic most effective for this species? And what are the side effects? So here's something. I went away, and Steve was having like this thing on his chin, and actually it started in his mouth. His teeth underlying started hurting. And I thought it was because, like, he was working out a little bit more. And you know how sometimes you can get like almost that TMJ, like when you go excessive and you clench down.
Can't say I ever. Well, I have TMJ, but not from working out.
Same. But anyways, I thought it was that maybe he was going a little bit too hard. And then he kept looking, and he's like, look at my mouth, look at my, you know, like, look at my mouth. It's kind of like me with my finger, but my finger's legit. Like, look at my mouth, look at my mouth. And I'm like, there's nothing in there. And he's like, he was to the point, he woke up in the middle of the night and he said, I think you need to take me to the hospital. And I'm like, no, I think we're okay. But he was flopping and whatever. So this went on a couple of days. He booked himself a dentist. Why did he go to the dentist? Where was the pain?
Teeth.
In his mouth, in his teeth. Yeah. And I said to him, Steve, I really don't think this is cofactor, because everything it's your entire bottom. You have a couple cold sores. This doesn't seem natural. And then the next day he started to get a red chin. So I said, actually, can you go shave your face for me? And right in here, that spot in the chin, you know, like the ball, it was glaring red. And I said, this is not, to me, okay, who am I? But I can say it to him, right? This is not, to me, a dental issue. This is not a mouth issue. This is a blood issue. Your blood is here. Is it a pelvic issue? Is it like whatever, like just traditional Chinese medicine? It's now coming up to your face. So we know that's a problem. And every single one of your teeth correlate to an organ system. So because it is from left right over to the right, because this man sees a doctor, I think probably 10 times in his entire life. One was when he was born. So when he says, I need to go to the doctor, like, this is a big deal. I said, okay. He goes to the doctor. Guess what they tell him? Yeah, I think it's just overuse of maybe some tongue muscles. And it looks like you could use a root canal. Hard I said, hard no. Like that, those are actual words, hard no. And I only know that because an email came to me in error with their recommendations. I wasn't there.
So what ended up happening?
So this is what I'm saying. What ended up happening is I went away. He woke up at 4:00 one morning because he was in utter pain. He went to the emergency. The doctor looked at him and said, it's an infection. It's definitely not isolated to the mouth. It's like a more over encompassing. And he lacerated the chin. No pus came out. Mm-hmm. Just put a Band-Aid back on it, gave him a script for the antibiotics. And I said to Steve, did you feel them? He's like, no. And I said, then what was the point of going? And he said, well, I had to check with you first. I know how you feel about them. And I said, you're in dire straits. I don't want a blood infection. Here's what you can do. Go to the herbal store down the street, and I want you to tell her what I say. Dirty blood, overall encompassing, issue, blah, 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 histamine, these types of things. She gave him 2 homeopathics. It was resolved in 24 hours. This is not all the cases, but I'm using this. This is not acne, but you see, this is just, so he thought it was the teeth. So he endured it. And then he went to the doctor, all of these things. Another client went in this week and said, and I got a script. I said, for what bacteria? Same thing I said to Steve. I said, did you have blood drawn? Did they do a culture, a swab in your mouth? Were they looking for anything? He said, no. And I said, how did you get in? He said, listen, I really can't help you. Take this antibiotic script, because if it does turn into something kind of lethal, you're equipped. That's what he said to Steve. Mm-hmm. Steve at least has a little bit of a preference. Other clients, when they start working with us, they do get scared to take antibiotics because we talk like this. Or I talk like this. But again, it's not about that. It's working through. Just become very educated. Ask the questions. What's the strains? What's the species? What's going on, right?
Mm-hmm. So now that we've really spent 25 minutes hammering home on antibiotics and all of the things, I kind of want to talk about how they apply to acne sufferers specifically, right? And how they are really just pouring fuel on the acne fire. Mm-hmm. That really connect it all together, and then let's go from there. So when we're looking at antibiotics, when it comes to acne sufferers, like I said, it's essentially pouring fuel on the acne fire. And antibiotics are heavily prescribed for acne sufferers because, the idea is that acne is a bacteria and the antibiotics will clear it up. And, in a lot of cases, absolutely, while you're taking the antibiotics, your skin is looking a lot better. But what happens when you come off of those antibiotics? And I can answer that question for you, because we have had hundreds and hundreds and hundreds of clients say the exact same thing, that my skin was looking pretty good while on antibiotics. I stopped taking them and it came back with a vengeance. It is 10 times worse than it originally was. And one of the big reasons is because the antibiotic is just putting a Band-Aid. It's strictly treating the symptom of acne, because acne is a symptom. There is something causing the acne. And there is always, 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 always a gut component to acne sufferers. Like, we can say that with certainty because we've worked with well over 1,000 women, the Clear Skin Solution, in over 10 different countries across the world. And we can see how heavily the gut plays into this. So let's just think for a moment, when you're all of a sudden taking antibiotics that are wiping out the good and the bad microbiome in your gut, completely just disrupting it. It can be taking anywhere from months to years for your body to recover from a single short course, which doesn't even encompass the long courses that acne sufferers are taking. And also it can be contributing to leaky gut, which is known as intestinal permeability, where the tight cell junctions of the gut, they get irritated, they start to pull apart, and they allow for undigested food particles, toxins, bacteria, things that shouldn't be into your bloodstream get into your bloodstream. They circulate throughout your blood, and then we're going to be seeing a systemic inflammation. So the systemic inflammation, the alteration of the gut's microbiome, this is all paving the way for acne to occur. So as you can see, this is why taking antibiotics for acne is just pouring fuel on the fire. That's all that it's doing. So now then you come off of it, your gut microbiome's worse than it was, the integrity of your gut lining is worse than it was, we're dealing with more inflammation. And when you wipe out the good and bad bacteria, or I should say the good and bad like microbes in the gut, this really sets the stage for the bad opportunistic bacteria and yeast to set up shop and take over. So now we're dealing with that poor alteration in the microbiome where we have way too much bad bacteria, because in a healthy gut, there will be some bad bacteria. There will be some opportunistic microbes. That just is what happens in the gut, but it needs to be in the proper ratio. So when we wipe everything out, we're allowing, that, that scale of microbiome to start shifting for the bad bacteria to take over, which is just going to be causing a slew of issues leading to acne. And I'm just going to keep on going for just a quick minute, Chris, you know how I like to do, is when we have this alteration in our gut microbiome, guess what's also getting impacted? Our hormones. So in your gut, it is home to this unique subset of microbes called your estrobolome. And this is where these microbes are responsible for manufacturing and metabolizing your estrogen. So if our microbiome is off, our estrogen is going to be skewed. And then this could be leading to a possible estrogen dominance. So this is why so often we have clients or even women in our community, in our DMs, whatever it may be, saying, oh no, I just have hormonal acne. I just have hormonal acne. I don't have any gut issues. Well, let's back up and remember that if we are dealing with an alteration of your gut microbiome, which we can confidently say 99.9% of acne sufferers are dealing with some level of alteration of their gut microbiome, this is going to be impacting their hormones as well. So you can be taking all of the hormone balancing supplements in the world that you want. And again, it's acting as a Band-Aid while you're taking it, because what happens when you stop? We need to be making sure that we backtrack a little bit and we set that gut up before we even go into touching the hormones.
Yeah, I like it. Makes sense.
It does.
Right?
Is there anything you wanted to add on that?
Just that remember, this is kind of key, is antibiotics, they work by, let's say, fighting the acne causing bacteria. So if you take the antibiotics and the acne goes away, chances are, it could be in result of a bacteria. Back to more of that leaky gut-like behavior. We already had to have a distension of something not right in the lower gastrointestinal, whether that's SIBO. Think about gas and bloating and everything. We're looking at SIBO, H. pylori. We're looking at microbiome being off, dysbiosis, all of these things.
Candida, like Chris, how many of our clients are dealing with a candida overgrowth? And guess what can lead to a candida overgrowth? Overuse of antibiotics.
Dang right. And UTIs, right? That's gonna be the next coming down the line, the BV, the bacterial vaginosis. But let's go back to the antibiotics invented to really reduce inflammation as well, like prevent, to assist. So even if we look at it from that, stress equals inflammation. So this was a pre-antibiotic issue. Mm-hmm. There was a compounding stress inside your body, inside your environment, outside your environment, endo, exo, whatever, to perpetuate that inflammation. So, in every antibiotic literature, it says should be taken short term, about 3 months. That is it. Still 3 months. Holy Hannah banana! Like I'm sweat beating here. But what's the fallout? What's the fallout with perpetual? So why don't you grab that?
It's going to be impacting your whole system, right? Because remember, when your body isn't just different departments that aren't all working together. Your gut is working with all of the different systems in your body. Your gut is working with your brain. There's that gut-brain axis where it's been shown that the alteration in your gut microbiome can be impacting your mental health and vice versa. Your gut is working in coordinations with your hormones. It's working in coordinations, like over 80% of our immune system is found in our gut. So if we are constantly hammering it, that alteration of microbiome and the antibiotics, guess what? We're going to now be dealing with a depleted immune system. So maybe we're getting more chronic infections like colds and flus. Maybe we're now struggling with an autoimmune disease. And remember, your immune system is also involved in acne because the immune system is going to be fighting the physical acne itself. So you can see how there's all of these little things that you need to start weaving together, that's all leading back to the gut and that use of the antibiotic.
Absolutely. That's what happens, but that perpetual insult we keep talking about, that overuse, the overprescription, that I'm taking it and I don't know why, that resistance is going to be a big problem.
And
Because,
I'll let you finish. No, you go.
I was going to say, because if people do stool tests, some people elect those with us, right, through doctors, whatever, and we look at that, and we look at the cultures in the species, some of them are wiped out. Candida is one of those little suckers that can hide. It can show as, he's none detected.
Candida is a sneaky little thing. It likes to hide in the biofilm.
Right. There's different types and times to test different things. So that's why working with a professional is great. When we get into that antibiotic and that resistance, the more exposure you have, the less responsive your body's going to become to it. And then what's going to happen is no matter what you take, it's going to be compounded effect. There was research, I'm going to spare the
Here
catastrophic.
No, geek mode. It's the catastrophic.
It is pretty catastrophic.
The apocalypse is coming.
Out of 100,000 people, 131 needed antibiotics in a survey that I was referencing. 131 out of 100,000. Okay. Now, if you look at the number of deaths from overprescribing, they're like, well, how does antibiotics, whatever, that's that antibiotic resistance. So what happens is your microbiome goes down, the beneficial goes down. We can still climatize with these little clever buggers because they can have biofilm. It's like bubble wrap, over Ida's like heirloom lamp, and you're going to travel somewhere, that bubble wrap to keep things really nice. That's a biofilm. And what happens is they become really resilient. When you change, they change. They want to live. So if we keep doing this, we have no idea. And then the microorganisms, they're going to spread quickly. And then we get a little sniffle, boom. And then that can do premature death, right? So that's why I say it's kind of decrepit. And it's not to scare anybody. It was just to kind of say, this is like a big deal. 131 out of 100,000 people, blow my mind.
That's a massive, massive number, right?
Yeah. We can't keep having the healthcare system we have without, what am I say? We can't really have to be very careful what I say. We cannot, one, endure the driving costs, but we also cannot endure the perpetuated insults to the quality of our body when our body is made to self-repair. Our body cannot self-repair when we insult it. Does that make sense? Because it does. Like you said, the liver needs to detoxify the hormones, right? That's just a small thing. Lymphatics, it collects a whole bunch of dirty germs and it sends it somewhere else, and those have to get taken out. I do have a little bit of hope for everybody if you would want to share the hope instead of the bubble popping.
I was thinking that now that we probably destroyed everybody's life and they're like now in panic mode and like, oh my gosh, my gut's a nightmare. I thought maybe
because I love them. I don't want them to do.
We want them to feel better.
To hurt. I don't want them to do what I did.
Same. I know. Like you and I are talking about this from experience because, like I said, I destroyed my gut for years with the extreme amount of antibiotics, the birth control pill, and I started this healthy living journey about 14, 13, one of those years, a bigger number of years ago. And to this day,
Is this mathing?
I don't like public math, Chris.
She does not like public math. No,
I don't. But it was over a decade ago. And I'm still to this day working on my gut health, even a decade later. It's massively improved 100%, but there's still these little lingering things that I'm working on consistently to improve my gut health. So I would like to give them this is what we're going to do, everybody. We're going to give you some hope. We're going to give some hope out there. We're going to talk about how we can start repairing our gut if you have taken antibiotics. And then, because this episode, Chris, was supposed to be on antibiotics and spironolactone, we should probably save at least 5 minutes for spironolactone at the end of this episode.
Fine.
Okay, so give them the hope, and then we're going to go in.
Becky over there.
Well, I had to really take the reins on this because we were going to be here for 6 hours on Chris's.
Because it's so important. Okay, I'm going to tell you why it's so important. Ready?
Okay,
this is why it's so important.
Go.
Oral antibiotic side effects, yeast infections, skin rashes, skin discoloration, darkening.
Are you yelling at me?
I'm excited. I'm not yelling. I'm excited.
I'm concerned for my safety.
Okay, fine. Increased sun sensitivity. Fine. See, it's not the same. You think when I go and I teach, I'm like, okay, class, this is not. No, you got to give her. Okay.
I know. I'm so glad. I'm a little concerned for your students. Like,
okay, liver inflammation, gastrointestinal infection, severe allergy reactions.
I thought we were giving them hope.
No, I'm saying this is why I am so.
I know. We know.
Right?
We know you're passionate. You just want to help people. That's
not only that. Here's the connection. So
go.
Most well researched are the tetracyclines, so the leads, right? So minocycline, doxycycline, even this, I'll give it to the clindamycin, we'll hang in there, for antibiotics for skin and tissue issues. Okay? So here's the hope. Garlic has been tested time and time again against penicillin. So streptomycin, erythromycin, all the tetracyclines. Oh my gosh, did Chris say tetracycline? Something to do with acne? Bam, connection, right? And it's been proven against some resistant bacteria that no longer respond to these prescriptions or these antibiotics.
We love garlic.
Garlic can be put into food. Do not do what I do, chop it up and take it, because you need to be really close to a garbage can.
You got to work up to that. There's so many different ways. Like Chris really loves fermented garlic. I'm obsessed with black garlic. I have a black garlic farmer. Literally, I can see her farm from my front door. We love garlic. There's even garlic supplements that you can get. Right.
Yeah. And I don't even want to go into those things because let's get into food because we love it. Garlic is
Okay, no, I was gonna go into the 4R approach and then go into food. Do you want to do that?
No, I gotta keep going.
Okay, finish the garlic.
I'm on a roll. That was another eye roll. Oh my gosh. Okay, so garlic, it is effective in prevention, candida, yeast, jock, fungus. What about herpes? You and I get herpes simplex. That's nice to know. What about the rhinovirus?
Can we clarify and say cold sores?
Oh yeah, cold sores. So the HSV1.
Can we clarify there?
Yeah, nothing funky down in my vaginal area. Yeah,
that's a great visual for today. Thank you.
Well, I'm on a roll. So let me just have it today. How often do I get to have the roll? Okay. So, and the common cold. Okay, there's different ways we can use it. Not to mention garlic. Parasites don't love it. Roundworm, hookworms, they're not fans. This is what we want to say. So fresh garlic is best, and garlic oil can be purchased. I ferment my garlic. You know that. When people are coming down with stuff, what do? When the dogs have something, what do? We talk about this. We apply it. We use a lot of fermented garlic to help aid this. This doesn't mean we don't use other things as well, but this is our go-to as soon as something starts going off. Right?
If I have Chris tell me one more time, did you get your garlic fermenting? How's your garlic oil doing? If I have her say this one more time, it's pretty much like her finger prick situation.
I'm just letting you know I will be at Kitty's house shortly, and I will be in the pantry.
She's going to be fermenting some garlic in my pantry.
This is not okay. I have no idea why you don't have that.
I have the black garlic. I just haven't gotten around to the fermented garlic yet. Chris, I got little kids.
Fine. I'm going to breathe in through my nose so that we can get to that spironolactone.
Okay, let's keep going.
Long story short is, let me just do this list, and that's just this thing.
Okay, go.
So what we call antibiotic herbs, for lack of better expression, aloe vera. It's a miracle plant.
You mean antibacterial herbs.
What did I say?
You say antibiotic herbs.
No, they're actually referred to as antibiotic herbs. They are antimicrobial, but they just call them antibiotic herbs, meaning similar complex. Sorry, teacher, I will forget. I have to change modes. So aloe vera, miracle plant, right? Garlic, ginger, golden seal, grapefruit seed, licorice, oregano oil, Oregon grape, turmeric, tea tree oil, St. John's worts. Now, please don't go and buy all these, because if you have an autoimmune, you can't take some. You have to take some so many days on and so many days off for the effectiveness. But there is one little nugget in here that I have said that can eradicate H. pylori. Bam! That's all I have to say. I'm not going to say what, because I don't want people to go take it because they don't know how to take it and at what quantities.
You keep doing this, Chris. See, you do this in like every other episode where you drop there's something in there that fixes this.
And then I can't.
And then
due diligence.
But then my DMs end up flooding. So instead, next time, let's just zip it over there so my DMs don't get flooded.
I have to do it. I have to show you how much we have effective in our herb gardens, in our ability to attract whole foods, to utilize what we have in order to mitigate a lot of the damage we do, because we don't even know what we do.
And to be honest, like, it's in the society that we live in these days, it is impossible to stay away from everything. You will literally drive yourself crazy because like you're gonna have to move up to the middle of nowhere in the snow in the Antarctic somewhere to get away. And even then there's going to be something. So just remember to do the things that's in your control and don't drive yourself crazy. So let's go into what some ways that you can start repairing your gut health after antibiotics is really take that 4R approach, which is remove, restore, reinoculate, and repair. So it's removing the bacterial or yeast overgrowth. It's restoring the good bacteria, reinoculating your gut, and repairing your gut lining. So again, there's a lot of things you can be doing yourself. There's most likely going to be something you need to work with a practitioner with, especially if you're dealing with a candida overgrowth, you have SIBO, you're dealing with leaky gut. Like, you really need to work with a practitioner where you can properly identify what's going on, possibly get stool analysis done so you can see what species are happening and properly go after it. But in the meantime, there's lots of things that you can be doing. So removing the bacterial overgrowth, this is where you'd want to be using, those antimicrobial, antibacterial loving foods and possible supplements. You also want to, again, be restoring it with the good bacteria. So this is where a good quality probiotic can come in handy. And if you want to learn more about probiotics, go back to last season, because Chris and I did an entire episode on probiotics as well, because it's not just about going to the grocery store and picking the first probiotic you see off the shelf. You have to make sure you're taking the right strains for what you're dealing with. You want to be reinoculating it and really making sure that you're getting that good bacteria. You are also, I should go back up and say that you also want to be removing any of those offending foods that is going to be making your microbiome worse, right?
Sugar.
So number one. Okay, you stole my thunder. You want to be removing sugar for sure, because this is going to be feeding. It is like a prime rib steak put in front of bad bacteria and yeast, and it is just proliferating. So removing sugar, opting for things like a little bit of raw honey or monk fruit or stevia, and really focusing on those nourishing anti-inflammatory nutrition and foods, really watching out for those pro-inflammatory ones, like the refined vegetable oils, refined sugar, or conventional dairy, the ones we talk about all the time, and really filling it with those loving, really wonderful foods. And then you want to be working to repair that gut lining. So there's lots of things that you can be doing to repair your gut lining. Some people love L-glutamine, you can do aloe vera, there's so many things and different herbs that you can be utilizing to really heal and seal that gut lining. This is where collagen can come into play. And you have to remember that this is not going to be a 4-week wham, bam, thank you, ma'am, you're done. In majority of cases, at a bare minimum, Chris, 90 days of consistent, focused work on your gut. And in that same breath, I want to say, it is very far and few between that it's going to take you only 90 days, especially if you're an acne sufferer that's taken lots of antibiotics. We have to remember that a good analogy is to take, for every year you've been dealing with these issues, taking these medications, you want to give yourself at least 1 month of repair and fixing and addressing. So that's really going to put you into that perspective. But like I said earlier, I've been on this journey for over a decade now, and I'm still to this day consistently working on my gut health because of the severity of the damage that I did. So don't think like, oh my God, 3 months of me doing this specific protocol. You may have to redo that protocol. You may have to do a next protocol because maybe you have leaky gut and you have candida and you have H. pylori and you have a SIBO and you have this and you have that. So you need to be making sure that all of these things are being taken into consideration.
I can redeem myself here.
Okay, go on. I'll let you try.
Probiotics, lactobacillus, and bifidobacterium. That's what you're going to look in a lot of different types of the species of those, right? To help rebalance that. Now, one thing is if you do take an antibiotic and all of a sudden you get raging diarrhea or really upset or bloating, chances are it's too high of a CFU, so colony forming units. And that will also probably a good indication of the disrepair of inside the gut if it's repelling that.
Mm-hmm. So just remember to, follow that 4R approach, remove the bad, restore the good, reinoculate the good bacteria, repair your gut. those are the things you want to do, and really focus on that anti-inflammatory nutrition. Pull back on all of that sugar, because these are things that are really going to massively improve your gut health. Really love up the things like the garlic, the citrus, the ginger, the turmeric, the olive oils, the bone broths. If you are on an omnivore diet, bone broth can be so incredibly lovely for your gut. And if you're like, Katie, bone broth, you're one of those people that bone broth worsens your breakouts, let's consider looking at a possible histamine intolerance. And we have a wonderful histamine expert coming up on the show in a couple of weeks as well. Anything else you want to add before we go on to spironolactone?
Amino acid complex, and people can go look at this: proline, glycine, and oh my gosh, proline, glycine. Now I forgot one. Oh, shoot, bananas! I just had it
L-glutamine.
right there.
I love L-glutamine.
No, L-glutamine is like it's kind of what we call like a special like
Yeah.
supplement. It does. It's a gut restorative. But proline, lysine, and I'm gonna have to get back to you. Why do I have a brain?
You're having a brain freeze. You're having a brain freeze.
You said histamine, and I started getting all excited. So
It's one of your favorite subjects.
I will come back to everybody on this, because this is going to drive me nuts.
Okay, well, let's move over to spironolactone, because remember, we're supposed to be showing the love a little bit. So another
proline, lysine, and guys, go into your amino acids. That helps repair the gut. That's it. Bam.
There you go. Amino acids. Okay. We love it. Okay. So
spironolactone, take it away.
So out of the big 4 acne medications we see, which is the isotretinoin, aka Accutane, birth control, antibiotics, and of course spironolactone. Chris, how many clients would you say that come in? What's the percentage of spironolactone?
I haven't done this statistic, but I would say solidly we're hovering between 60-70%, a solid amount.
That have either previously taken spironolactone or currently
on it.
Yeah. So spironolactone is actually a medication that is used to treat high blood pressure, and it's an off-label use for acne, right? So the spironolactone is it's a diuretic, right? So it's something that will be expelling water, and sometimes it's also referred to as a potassium sparing drug, because it can actually have the body retain potassium while excreting sodium. And when we're looking at that spironolactone, it has a testosterone suppressing effect. So this is why it is heavily used for acne, because again, the thought process is that the androgenic hormones are causing the acne that are increasing the sebum production in the skin. So just like a birth control pill, which would be suppressing androgens, the spironolactone has a testosterone suppressing effect as well. Anything you want to add, Chris?
I like it. Keep going.
Okay, let's keep going. So when we're looking at a spironolactone for acne, the reason, again, why it's used is because it blocks those testosterone receptors, and it actually inhibits the body from making those androgens. And remember, androgens is that class of hormones, which includes your testosterone. So if we are seeing, that they have acne, but they also have really oily skin, they have the unwanted hair growth in places you don't want to have it, like the chin, like the chest, this is where we will often see spironolactone be prescribed. So I'll let you finish. I'll let you do the next chunk. Here she goes, everybody.
No, I'm not going anywhere. This is just, again, it's just one of these overprescribed off-label, right? It is when it becomes a diuretic, what does it directly do to your adrenals? Currently have a client that has high cortisol, has since a child, and is on spironolactone. My heart starts racing for this, right? It can cause premature heart palpitations, dizziness, all of these cofactors. Why does it work so well? Like you said, it blocks the androgen, but out of that 60-70%, less than 10% needed it. It didn't work. It didn't improve. How you really know, maybe if there is that androgen codependency or regulation needed, is that your skin should improve, and it doesn't take long, not as long as, they say. You shouldn't be having to go up to 150, 175 milligrams to make your skin look, something's wrong. Something is definitely wrong. So when we look at that spironolactone, again, the sodium and the magnesium for the adrenal health, that's going to be impacted. But I'd like to step back a little bit and I just want to quickly look at, because it can impact the kidneys and the adrenals, we know that can then spike up and drive up cortisol, which is our stress-like hormone. And cortisol is catabolic. So it breaks
Mhm.
things down in the body, right? Just like when we're super stressed, we tend to get colds, or maybe our finger hurts longer. I don't know. So I'm not going to let this go.
This finger, Chris, it is the thorn in my side this week.
They should tell you how much it hurts. Okay. Anyways, I digress. See, because I don't get empathy all week, I have to wait here till I have you captive.
I gave you empathy on day 1 when you told me about it, but today's what, day 5? I have no empathy left on day 5.
And it's actually day 2, but what else?
I gotta go back and look at our chat history.
Mm-hmm. Yeah, I'm using Arnica. Don't worry, I'm taking care of myself, Katie. So when we look at that cortisol and it breaks things down in the body, the other balance beam is DHEA. And DHEA is absolutely anabolic. It builds things up and it helps the adrenals. But guess what?
Mhm.
It's also in the same pathway of that testosterone. So please, before we start to go, okay, yeah, spironolactone may be the end all be all and these things, look at your stress-like pattern. Look at the stress. Look how you're balancing your meals. Do you have a blood glucose imbalance? Because if it is a true androgen, you have a blood glucose instability. Like I don't know if there's any publication that disputes that. Do you?
Not that I know of.
Right. So if we're using it for off-label and we are on it long-term, and you're scared to come off of it because that's the and, right? They're scared to come off of it. What's the long-term effect? Because I always ask clients, what is the long-term effect that your doctor has told you? And they said I can take it forever unless I want the acne back. That was last week. Unless I want the acne back. It's like, they said they went to the doctor with a chart because they wanted to come off of it. And then they said, well, if you want the acne to come back, then go for it.
No.
Now do you know why I get so revved on this stuff? This is like your birth control, right?
I equally get revved on it. I do, but one of us has to keep their cool today. Oh, like with me, you and Paige, only 2 of us at a time can be having a meltdown. One of us has to stay strong for the other 2. So just like today, I'm staying strong for everybody listening.
Taking it for the team.
I'm taking one for the team today, everybody.
I want to know something about spironolactone right now.
I might already know it, but give me a refresher.
It's controversial. I don't know. It's something that it's controversial.
Gosh. You know how I feel about controversial. My anxiety's rising.
I know, but I just want to tell people it is being tested as for the importance for host viral interactions and the potential benefits for enhancing host defenses in our body. So they're now looking at spironolactone, which is a diuretic, to go after viral infections such as SARS-CoV-2. I'll let you just read between the lines.
Nope, don't wanna.
Yeah, so it's the conversion, it's the receptor, it's all of these things. At the end of the day, I'll share the publication with you, Katie, because you can decode a lot of that geek.
Pop it in Slack.
It's going to be ugly. But I just want to let you know, as the publication goes further, it says we want to use this to enhance our proteolytics, so the protein enzymes in order to break those things down. Well, what's the number one cause of usually the gut? Not the number one cause, but digestion. If we can't break down our proteins, we're going to cause putrefaction and rotting and leaky gut and all of these things. So then we're back to the antibiotics. Mm-hmm. Because what if this pharmaceutical is also compromising that aspect of it?
Yeah, we often see these pharmaceuticals used in some type of conjunction with each other.
Mm-hmm. It just makes me nervous because anything that says we're looking at studying this to help diminish the binding effects that the viruses cause in the body. Mm-hmm.
Oh, right? I was going back to acne. You're still on the viral.
No, because what is acne? Either it's bacterial forming, it's the catastrophic breakdown inside the body, either we've broken the body down and now we have to build it up, or we've built it up too much and we need to bring it down. Mm-hmm. That's essentially how the body works, right?
Yeah. And if you are somebody who is actually dealing with high androgens in the body that are contributing to your acne, and I say contributing because it's always a multifaceted combination of gut, liver, hormones, lymphatics, mindset, stress, sleeps, all of it. So if one of the components of your acne is androgen based, there's, there's lots of wonderful natural herbs and supplements out there that you can be looking at for androgens, things like zinc, things like spearmint, things like saw palmetto, things like reishi, maybe vitax, maybe peony. Like there's so many different things that can be utilized in conjunction with that holistic plan of, repairing the gut, getting the nourishing foods, having that right balance, working on your cortisol. It like I said, it really is a multifaceted thing, and never feel like your acne is being caused by just one item.
Right. And you are 110% a part of your medical journey.
Mm-hmm.
Ask those whys. It's not about being confrontational. Just please get out there, start advocating for yourself. If you truly believe that, there's a holistic approach and you can take it, come join us or join somebody that you resonate with to take those changes, because we see it all the time.
Mm-hmm. All right, everybody. So this was a big episode. You'll probably have to go back, listen to it again. Other podcasts I recommend listening to would be, the probiotic episode from last year. If you want to dig more into gut health specifically, we have one of our very first podcasts we did on it earlier of the season of season 2. We did a podcast on leaky gut. So remember, like all of our podcasts we do, there's complimentary ones. So I always encourage you, after you're done, whatever podcast you're listening to, go and search through our library, whether it's on Spotify or Apple or over on our website, and search for keywords on our website. And you're going to be able to see those complimentary podcast to what we talked about today. But that is it for us. We're at the 1 hour mark, everybody. So join us next Wednesday here on the Clear Skin Chronicles, because we are going to be discussing a holistic approach to perioral dermatitis. We'll see you then.
Thanks for hanging out with us this week on the Clear Skin Chronicles. We'll see you next Wednesday with a brand new episode. Remember to subscribe to the show and drop us a review. Sending glowing vibes your way, Katie and Chris.